So the first question we're going to be answering today is, if you own your own practice in the future, what precautions or steps would you take to prepare for and then to practice through times of uncertainty? Now, I really enjoy this question because when I was talking with one of my informational interviewees, Christina Gomez, she was talking about how physical therapy is evolving faster than we know it, and that eventually, at one stage, we will probably be able to go virtually into the world of medicine. So, physical therapy, you have to attend your physical therapist meeting so that they can help you out with whatever problems you're having. What Christina Gomez and I started talking about was how this coronavirus has affected going to face meetings with other doctors, and that we could be able to administer help to other patients virtually, like we are in videos and on Zoom. So we would be able to move into the virtual world to progress with medicine instead of having all these face to face meetings. And that's how we can evolve in the future with physical therapy. What this coronavirus has taught us is that even in the future, if we have other crises, we are still able to help our patients medically, because without medicine, there's going to be problems in the world, which are obvious. If we do not have medicine to combat most of the diseases that are existing in the world, then we won't be able to survive. That's why medicine is a common necessity, and that every single person should have access to it, no matter what the crisis is, virtually or face to face. If there are other methods of administering it, if we somehow create machines, that would be perfect. But as a business owner, I would try to take steps to make my company as accessible as possible, whether it be through websites, whether it be through face to face meetings, whether it be through Zoom meetings. We would be able to create some sort of system where both the patient and the physical therapist slash doctor would be able to help everybody that is struggling with a problem. Now, we know that the coronavirus has caused us a lot of problems over the past couple of months, but we can see through medicine that we are able to fight back the coronavirus. We have been able to quarantine, we have been able to administer medicine properly, we have been able to help everybody that is in need. Yes, there are some people that are more affected by the coronavirus, such as people with respiratory problems or people who are old of age or young of age, and we are still able to fight back from this coronavirus. Even in the past couple of weeks, we've seen a decrease in the number of cases for coronavirus, and people are still comfortable enough to go out and protest today, even though the coronavirus is still imminent in the country, which shows that we are confident with our medicine in this current day and age, and we are still going to be able to feel confident in our medicine in the future because it is constantly evolving and it is constantly helping people no matter what the situation is. The second question we're going to be answering is, has your experience with the coronavirus inspired you to do more in the field of healthcare or created a feeling of apprehension? Tell me why or why not. Now, because of the coronavirus incident, I've been really inspired to try and come up with a way that physical therapists are able to see their patients. I've been doing research wherever I can, and I've been talking to my informational interviewees. And doctors like Dr. Adam Lambert, who I interviewed, has talked about how he managed to create a system where he would be able to see patients in one room and still be able to talk to them and tell them what their problems are and to be able to examine them while still keeping protocols by staying apart and being able to talk to each other. And it's just those little tweaks and fixes that can save humanity, because if we can still meet our physical therapists and meet our doctors in person, and we can still stay safe from the coronavirus. This inspired me to look into the annual conference that is held for biokinetics and kinesiology, and it's helped me understand that through the guest speakers that come in that are very prestigious in the conference, they talk about whatever the problems are for injuries, for diseases, for whatever may occur in the modern day. And such conferences helped develop medicine and techniques to combat situations such as concussions. It wasn't very prevalent when it first appeared, until a doctor came out and started studying the brains of football players. He understood that the damage to the brain was almost irreparable when it got to a certain stage. And we were able to administer safety guidelines, we were able to administer medication, we were able to put restrictions on some sports. And that is why safety has evolved, and that's why medicine has evolved. Because of conferences like this that are held every year, we are able to constantly fight back whatever problems are occurring in the world. Physical therapy is very difficult when it comes to trying to avoid face-to-face meetings with your patients, because some patients need fixes with back problems, or some patients need to look into joints or neck problems or something like that. And it's very difficult to be able to help somebody virtually to be able to fix those kinds of problems, which is why the studies and the information gathered to look into these issues is very precise and very thought after, because professionals nowadays are also trying to find certain ways to help patients without meeting them face to face if there are situations such as the coronavirus that occur in the future, where people coming into contact with each other will be a lot more dangerous than it is to help them with their back or neck problems. Is very important to me because coronavirus has stopped people from going outside and being physically active and watching sports on TV, whether it be basketball, soccer, football, hockey, whatever it is. People have been deprived of that entertainment, of that health and that fitness. And that is why situations like the coronavirus are very important to me, because it helps us think, okay, what do we do now to fight the coronavirus, and what do we do now to help everybody that we can possibly help? Thank you for listening to my thoughts about the evolution of physical therapy and how we can possibly combat any other problem that we face in the future. And I hope you enjoy your day.